I've basically got tablets for heart pressure, depression, for anti-alcohol, for pain, for mobility as in arthritis.
After 10 years as an electrician in the Navy and several deployments in the Middle East, Charlie Anderson carries the scars.
We've had to do some horrific jobs. Back in '89, actually had to pull in, it was about 12 bodies, and we actually put them into the cool room, took them around to about 3 different countries. No one wanted to know who they were, so we ended up burying them at sea.
Following Charlie's discharge in the late 90s, his wife Julie says he found it difficult to hold down a job due to physical injuries and ongoing trauma.
The pain is bad all the time.
My stress levels were going up, so I started drinking heavily.
Blood pressure's been out of control all year.
In recognition of his service, the Department of Veterans Affairs pays Charlie a fortnightly pension and provides him with a gold card.
The gold card means I get my medical actually covered, so all my tablets, ongoing treatment, things like your physio, chiro, even your dental, all that type of thing.
The Royal Commission into Defence and Veteran Suicide is now in session.
Following the Royal Commission into veteran suicide in 2024, the government injected $500 million into veteran care. A flood of new medical service providers appeared, offering to help veterans like Charlie with specialist reports like physio, medical referrals and compensation claims.
These organisations just popped up overnight, like there was one and then all of a sudden there was a lot.
Not all of them are doing the right thing.
I got a phone call out of the blue, and the bloke's initial phrase was, "Hi, I'm your new psychologist." And I'm driving along and I'm just thinking, no, you're not. Why are you calling me?
A few months later, Charlie and Julie were going through his medical records and were shocked to discover the so-called psychologist had charged DVA for 2 consultations that didn't occur.
We have no idea. That never happened.
These people are purely, this is their business model. They have set themselves up to tap in on the DVA, purse, basically.
What happened to Charlie Anderson is not a one-off. 730 understands an estimated $500 million of DVA's budget in the last financial year has been lost to fraud. We've obtained a stack of itemised medical bills showing DVA being charged for services that veterans say they didn't receive. These veterans' records include 67 appointments that never took place.
If you're billing for something that you did not engage in, or that was not the time that you have suggested that your billing code indicates, then yeah, that's Medicare fraud.
After 30 years of service in the Army, Mackay GP Kerry Summerscales now helps veterans with their compensation claims and general health. She discovered some of her patients' medical records were also full of appointments that couldn't possibly have happened.
You've got the social worker that says, billed in rooms. Interesting, when they live in, Perth, and we are not in Perth. So, and the veteran didn't travel to Perth.
GPs like Dr. Summerscales can charge DVA for Coordinated Veterans Care, known as CVC, to compensate them for their ongoing care for a patient.
It's actually a care plan, and it can be up to just over $2,000 per veteran per year.
However, she found out that the CVCs she was owed in a number of cases had already been claimed by another clinic.
I think that's repugnant. It's repugnant because they're not providing care. All they're doing is taking the money.
Kerry Summerscales reported the incidents to DVA. Luke Armstrong is a military advocate, paid by veterans to help them access their lifelong entitlements. Last year, he was criticised by a witness at a Senate inquiry into veterans' welfare for charging veterans a 9% commission for his services. He says the business had done nothing wrong.
We're incredibly transparent with what we do. We ensure the veteran is aware of all their options.
Several months ago, Luke received a phone call with an extraordinary offer.
Hello.
Oh, hi, it's Luke here from KSC Claims. How you going?
Good, how are you, mate?
Yeah, good. Apologies for the phone tag.
Veteran Can, a telehealth medicinal cannabis company, promised him thousands of dollars in kickback money if he referred his clients to them.
You can make the offer to them and say, look guys, if you've thought about medicinal cannabis, this is the easy way. Just click on this link. A jot form will come to me, and then I can ring them and say, hey, would you like to try it?
The more cannabis a veteran used, the more money Luke would earn.
So what happens, mate, like with the other advocates, we decided we'd put in a 10%, or actually a 5% sort of kickback to like a commission monthly in perpetuity. So for every person you get on, you've got them for life basically. And the advocates are like, the people that we've got on who've referred, or some of them are getting, one of them's just giving, getting around $17,000 a month, and it's getting higher and higher as they add more and more people on.
In 2024, Veteran Can's parent company, Dispensed, was investigated by medical authorities for prescribing large amounts of cannabis to one patient with psychosis and to another who took his own life.
From a medical point of view, do we need to refer them to their GP or their psychiatrist, or how does the work?
We do it all. We've got all the doctors in our system.
I'm pretty shocked, if I'm frank, because it's incredibly brazen. We've had no relationship with these people before. It's not like this is someone I've known for a year who's now offering this. This is literally my first ever conversation after receiving emails.
Luke was alarmed but stayed on the phone to document what was being offered.
Would you guys recommend that we have some sort of disclosure that we're receiving that, or that's not something?
No, that's a private thing between us and you.
Veteran Can said this conduct is not aligned with their policies or practices, and they are reviewing this claim internally.
It's not just exploiting veterans, it's also exploiting the Australian taxpayer, it's exploiting DVA, it's removing the integrity of the process. It's also putting veterans in a very vulnerable position.
DVA told 730 that kickbacks, if proven, may be unlawful, but declined to comment on the specific allegations. It said financial incentives for referrals are a known issue and that it would take action to ensure veterans are not subjected to this predatory practice.
What is being done to substantively change the law so these cowboys cannot continue to operate and rip off literally tens of millions of dollars from veterans?
The Senate inquiry also discussed a concerning increase in allegations of rampant fraud across the sector. So far, the billing practices of 80 health and medical providers have been investigated by DVA. Psychiatrist Alex Lim, who works primarily with veterans, says the sector is awash with anecdotes and claims of widespread misconduct.
There are brown paper packages that are offered to health clinicians. There are brown paper packages filled with money that are offered to advocates. And of course, swirling around all of this is just a lot of money.
Dr. Lim provides DVA with diagnostic reports that help them determine how much compensation veterans are entitled to.
The more conditions, the more disability per condition, the compensation payout is greater.
In his role on the Military Veterans Committee at the Royal Australian and New Zealand College of Psychiatrists, Dr. Lim was contacted by a colleague whose diagnostic reports had been allegedly altered by the veterans advocacy business they were contracted to.
If you have a good and true psychiatrist, and it's a good and true psychiatry reports generated, and it says the psychiatrist has identified 3 conditions, but the report gets altered into 5 conditions for the purpose of increased compensation. That's unethical. That's unlawful, probably. Problematic then to the public purse is clear, but also problematic to the integrity of the entire system.
This allegation has been reported to DVA.
There's a level of distress that's high enough that in this population that is a at-risk population, that the risk of increased suicidality suddenly goes up. And if the person they've knocked the door onto is incentivized by profiteering, not healthcare well-being, that's a problem, because we could lose another veteran.